Hi everyone, I am Francesca Cerutti, silver member of Style Italiano Endodontics. Today I would like to show you a case that was sent to me by a colleague. And it was kind of tricky because until I finished it, I wasn't sure I would have made it. So let's watch it together. This patient struggled with a sinus tract for about 1 year before being sent to me. And as you can see from the radiography, she had an unsuccessful endodontic treatment and an unsuccessful apical surgery. There was a huge metal post inside of the tooth, and the first thing I had to do was to manage to remove it. So I used two kinds of ultrasonic tips, dry and with water port, in order to move the post, and very slowly I tried to extract it. I used short and long ultrasonic tips. The long one were smooth in order to avoid any creation of ledges. And as you can see, the post is slightly moving through the coronal aspect of the root. So with a lot of patience, I managed to extract it. And it's popping out at a certain point. When I removed it, I couldn't believe it has a bifurcation, and it was like 13 millimeters long. After this, I wanted to check if this huge post had fractured the root, because it was a real possibility. Screw posts are kind of traumatic for the root. There you can see the apex. So I used methylene blue to see if there were fractures, but I couldn't believe my eyes. There was no sign of fracture. So I tried to shape, clean and fill the root canal. There was not much to do about shaping because it was already a huge taper, so I didn't want to enlarge it. I just used the irrigation standard protocol, and then for filling I chose to use MTA because the diameter of the apex was quite large. So I placed the collagen barrier over the apex in order to stop the MTA while positioning it, and as soon as I achieved a decent amount of collagen barrier, so I was sure the MTA would have not gone out of the apex, I used the map system and the MTA to position my filling, and I gently adapted it with a micro brush. Then I positioned a wet paper cone into the root canal in order to help with moisture the hardening of MTA, and positioned a provisional filling. So I sent the patient to the colleague in this status. 1 week after the procedure, you can see that the sinus tract started closing. 2 weeks, it looks even better. So my colleague, which is an orthodontist but is good also in restorative, managed to restore the tooth. And as you can see, 1 month after the procedure, the sinus tract has completely disappeared. So let's keep our fingers crossed for the healing.